All right, so we got out of the way the different settings, which there's 4 basic settings, right? FiO2, PEEP, oxygenation, tidal volume, respiratory rate, minute ventilation, CO2, O2. But people, I think, get overwhelmed with the modes of ventilation. What do you think is the simplest mode? So what if a patient's just spontaneously breathing on their own? So it's like, we call it like pressure support, PSV, or pressure support, or, and again, a lot of the respiratory therapists will chime in on this one, is like CPAP, so continuous pressure. We're overcoming, right? They have a tube that's probably like a 7.5 French endotracheal tube. You need some type of positive pressure to just overcome breathing through a straw, okay? So that's like as minimal as it would get. We would put somebody on this. You mentioned for extubation the RSBI, or the what's called the Tobin index here. So this is the rapid shallow breathing index. So somebody would be on just pressure support, and we would be weaning towards getting them extubated. And that would be one of my criteria to look at, okay? All right, what's another one that we typically see? How about this? We have multiple patients that are on a paralytic drip, prone, craziness. What mode are they on?
ACVC?
Exactly. So they're on assist control. So that's like the polar opposite of this one. This is where we are in full control of everything. So literally, again, that's why on our gas, we need to make sure, especially I always think, we're having issues with oxygenation. We know that. We're peeping them up. We're proning them. They're on high FiO2s. We know we have an intrinsic oxygenation issue. However, when someone's on a paralytic drip, you now have full control over their ventilation as well. So this is where their minute ventilation is going to come into really big play here, because they're paralyzed. So you have them in assist control, either volume control or pressure control. We like volume control, especially on someone paralyzed, because again, we are in full control of what their PCO2 is going to be. We're totally ventilating for them. They have 0 respiratory drive because they're on a rocuronium drip or whatever drip they're on. So this is, again, full control. So then what is the in-between world? And that really, to me, is like the easiest way to just keep all of this separate. What's in between that most other patients are on? So full control, patient in control.
I feel like it's called SIMV.
Yeah, SIMV. So that's the other one that to me is like the in-between world. So synchronized intermittent mandatory ventilation.